And I mean, no disrespect in asking this, but we've obviously done hundreds of
Look at her
programs during the
eyes.
course of COVID-19, and I don't think we've ever had a guest who kept their mask on during the interview. So again, without prejudice, I merely ask, how come you're wearing yours now?
So let me explain. So I'm a doctor. I'm a family doctor. I see patients in my office. I just had patients who are in my office with their babies, and I have more patients coming in this afternoon. COVID is airborne. That means that COVID remains in the air even after you've left the room. I keep my mask on. It is a way to protect myself. It's a way to protect my patients. It's a way to protect my staff and the community. It is what healthcare providers across the world are saying that we should be doing. And it's really not a hardship. I wear my mask from the moment that I arrive in my office in the morning until the end of the day. It's a simple, safe, effective measure.
Gotcha. Okay. And I mean, no disrespect.
Gotcha, of course. Without using the obviousness of look at her crazy eyes, what's your guys' reaction to that?
I mean, honestly, my first reaction was, is her skin that red? But that might be a camera thing. But personally, she might be a medical doctor, but she's in need of some mental assistance, I would say.
Okay, all right. I'm not gonna go that far, but I've been to doctor's office, and when a doctor is speaking to me, he removes his mask. I guess he's a bad doctor, and she's a great doctor. I don't know.
Well,
I myself, I'm not a big fan of the mask. I'm not a fan of the mask at all.
Yeah, likewise.
Are we allowed to say it's no longer like?
I think on YouTube you're allowed to question mask science now. As of a couple weeks ago, we've been granted that by the gods at YouTube. The idea that she's going to not catch something, a floating virus that she's in a room with because of her N95 is just not true. It goes to the idea that when you're on a bus crammed next to each other or on a subway car and you're inches away from somebody, you're somehow safe if you're wearing a mask. I mean, you have ear holes, you have eye holes. N95 is not meant for, virus protection, dare I say it, Sydney Fizzard. So I think we're just dealing with a crazy person.
We're all getting back to normal now, folks. So let's start there. Are we back to normal yet?
No. So the language that you use when you say something like normal is a far right language of anti-maskers, anti-vaxxers, and ableists who disregard the impact of COVID on seniors, on children, on educators, on essential workers, on healthcare workers, on our healthcare crisis. There's nothing normal about getting COVID, repeated infections, children and adults being hospitalized, and long COVID. There's nothing normal about taking away the protections and the proactive measures that we had to help to reduce transmission of COVID. And there's nothing normal about getting rid of any kind of isolation requirements, which would have helped to curtail outbreaks in schools, in workplaces, and everywhere else that you go.
We're all getting back to
first of all, let's point out that she's out of breath while talking because she's wearing a mask, but she may be, knowledgeable in her field, but she hasn't looked into any of this stuff. Nothing that she commented on there was accurate. Maybe you could argue that she said that older people, it's ableist to assume that old people don't need any extra care, but nothing she said there was true. I find it hard to believe that a person who works in the medical field can do zero research into something that's taken over our whole lives. But if we're going by her logic, then we should have been wearing masks all along, and we should never take them off on the off chance that you might get sick with something that could sideline you for a couple weeks or be detrimental to people who are immunocompromised or otherwise have a poor immune system for the sake of being old or having another illness. Guys, what do you think drives a person to continuously, be hiding in this manner or be still so afraid of something that we know statistically the chances of a person dying are so slim? We've got a couple years on it now. And to her point about, continuously getting affected, this doesn't set off any alarms in her regarding COVID vaccinations or vaccine efficacy. She just blows right through that and blames it on people, not doing the thing that she suggests.
You want to say?
I mean, if she wants to tell us how to live, maybe she should run for office. I'm so happy that these experts are no longer the influencers of public opinion, because I think the public opinion has shifted. They had power over us last year, the year before, But now it seems like that has diminished, despite of her saying, "Oh, this and that, we should do this. This, I'm a health worker. I'm an example. I'm setting an example. We need to protect this group of workers, that group of workers. Getting back to normal is a far right conspiracy theory, blah, blah, blah." The majority of people watch that and they say, "What is she talking about?" But she still thinks that the public opinion is the same as it was last year.
Well,
Sid,
people
do you
like
think
her
that's
have
true? Sorry, do
What's
you
that?
think that's true that people are watching that and saying this person's not making any sense?
I think for the most part, most people would be. But I just want to say, like, those who continue to wear a mask, I remember before this that it was a common thing that in China you would wear it because of the smog, right? Now that's a different conversation, but there was a normalcy around it in relation to that. But now people are taking it on as there's this moral umbrage and there's this fraction of a support it'll get. Well, you still see people wearing masks that'll go into a McDonald's or a Tim Hortons or wherever. And that fraction of a support or a fraction of protection that you got from wearing a mask, you just lost, because instead of making a coffee in the comfort of your own home away from everybody else, you decided you were going to go into it's not a public kitchen, but basically might as well be. Filled with a bunch of people that you don't know. Constant liquids are being handed around, and you're going to still wear a mask. I mean, these people clearly have Stockholm syndrome. They've been fed a very, very harmful set of bits of information, and now they don't know how to relinquish themselves from that. And they think now, if you take off the mask, you're bad. And, I just want to say, when it comes to wearing a mask, well, that's probably the least environmentally friendly thing they can do. And I bet you a lot of the people wearing masks are also strong advocates for the environment.
Oh, hi. That was a clip from our Rebel Daily live stream. It's hosted Monday, Wednesday, and Friday by the big boss man, Ezra Levant, and Tuesdays and Thursdays by me, Sheila Gunn Reid, and my good friend, David Menzies. On the live stream, we talk about the news of the day, we show some videos, and we interact with our viewers at home. We stream at 12 noon Eastern, 10 Mountain. You can find us on YouTube, Rumble, Super U, and Odyssey.